Thank you very much. It's a pleasure to be here, and I'm really excited. I finally meet Judith. We've been talking back and forth online for a couple of months, and so it's nice to be in Texas. So I'm going to start off with a little bit of history about where I came from when I was younger. When I was younger, I was extremely scared of the dark, like to the point where if I needed to go from my front door to my car, I would actually ask my husband to stand at the door so I could make it to the car. And then when I would go from the car to the hospital, I would have staff meet me outside so I could walk from my car into the hospital, because the dark petrified me, almost to a hyper anxiety situation where I really just didn't want to go outside after dark. And that's important because once I tell you my story, you'll see the significance of that. So I'd been a nurse for maybe about a year, not very long, and I felt like God had pushed me in that direction. There were certain things in my life that happened in a pattern, and I ended up being a nurse. So it wasn't like I grew up wanting to be a nurse forever and ever and ever. It was this set of patterns, and that's how I've always lived my life, as I watch the patterns and I let God guide me, and I can see certain things that say, oh, I get it now. That's why that happened. So this can happen. So that can happen. Even if it's a traumatic incident, then I know I can see the pattern of why it's going. So I ended up being a nurse because I felt a lot of compassion, and I knew that I was supposed to help change people and provide a listening heart and provide a certain level of care, and that was seen as the next step. So I was a nurse, and I ended up having knee surgery because I'm kind of accident prone and popped my ACL, and so I was having knee surgery. And I went into OR, and I remember talking to the physician and all the staff because I'd worked at that facility, and here I was, just no big deal. It was just surgery. You know, we do that every day. We're always either in surgery, ER, ICU. This is something that's totally routine for us. And I get out of surgery, and I'm in recovery, and I remember them telling me that they had given me 20 milligrams of morphine. And I thought, that's awfully a lot, but maybe I misheard it, you know, because when you're coming in and out of consciousness through the surgery, there are things that you hear or you say. There are things you say that the nurses look at you like you are completely crazy. So, you know, I just dismissed it. I went in to my room. My husband was at the room with me, and the nurse came in and was doing her assessment, and she said to me, "Are you in any pain?" And I remember thinking, no. And I said, no, I'm not in pain, but I can feel my leg, meaning I know they didn't cut my leg off, but I can feel it, right? And she goes, well, let's stay on top of that. And she gave me 100 milligrams of Demerol, which I'm very, very sensitive to medication. So let's put this in perspective. If I had 12 milligrams of Demerol, I would be totally fine. But she gave me 100 milligrams of Demerol. I remember thinking, oh, that didn't even hurt. Like, her giving me the shot didn't even hurt. That's pretty cool. I like this medicine. It doesn't even hurt. And then it was black. Pure black. Now remember, I was scared of the dark, right? I mean, petrified of the dark. And I was in a room or in an environment that was so black that when I held my hands up in front of me, I could not even see them. And I remember thinking, I know my hands are attached to my body. How come I can't see them? It is so black. And then I realized, wait just a minute. I'm not even scared. Why am I not scared? Doesn't that seem odd that I'm just here? And then I looked at my hands doing this and going, oh, hey, it's getting lighter. And then from that point, I saw myself standing in the darkness. And I remember seeing myself standing in the darkness, and I couldn't quite, I was thinking, who is that? But I knew who it was. Does that make sense? I knew that was me, but then at the same time, I was like, how can I be there when I'm here and I'm standing in the dark and not afraid? And then I all of a sudden was back into me, and everybody says there's this tunnel, right? But what I saw was light, and that light was so bright that it made the darkness seem like there was a tunnel. And then I started moving toward that, and then I hear, oh, her blood pressure's 90/30. I think we've got her back. And I said, 90/30? 90/30, 90/30, that's really low. And she says, yes, she's awake. She's awake. And I remember going, wait just a minute, 90/30 is really low. I said, all I was doing was sleeping. And she turned to me and she goes, no, honey, you were dead. And I said, I haven't slept like that since I was in high school. That was awesome. And the anesthesiologist, I at this point can focus on what was going on. After the Narcan, I don't know, Narcan makes you like vomit, but I could focus. And I saw the mask, and I saw the anesthesiologist over me, wondering if he needed to keep bagging me. I look at the end of my bed, there's all these people around me, and my husband is standing there with 2 guards holding him back with a crash cart in front of him. And I'm like, wow, all these people are here? This is so cool. So it was quite an experience, right? But from that point, I went home and thought, why do I exist? Why am I here? This sucks. Why did I get put back on this earth when I was at that point of living in so much fear before that happened, and there was so much peace, and now I'm back? You know, of course, I have my kids, and I have my loving husband, and I have all those things that I should want to live for. And it wasn't, I'm going to be honest with you, it wasn't until today when I heard Dr. Grayson say that from that point, you're always looking for something to fulfill you. You're always looking for that one thing that's going to give you all that passion back, and you can't find it. And that has been my life for years. This happened 15 years ago. So for the last 15 years, I've been in this big depression of, why am I here? What's the significance? Why am I a nurse? First off, I became very dissatisfied with nursing. Very, very dissatisfied with nursing. And part of it in the years of discovering why I would be dissatisfied isn't because I don't want to save somebody's life. That's not, CPR, when you do CPR, it's a good day at work. I like CPR. It's when I'm doing CPR on a bilateral amputee who is on dialysis, who has stage 4 cancer, and I'm bringing her back to the trauma. Remember that one, I don't know if you were here, but the one case study where she was up there and then all of a sudden she came back into her body and it was traumatic. That's what we're doing. Every time we're doing CPR on somebody, they're in that world of love, and we're bringing them back in a traumatic environment. And I couldn't cope with that. It wasn't that I didn't like it, I just couldn't cope with it. So I almost came fascinated with death, with the transformation. I don't know if anybody's been with somebody when they've died, but when they die, they're there, and there's a spiritual change. And if you're really in tune with it, you can feel it. You can feel their spirit lift, and then they're not there. That is like the coolest thing ever. So I almost came fascinated with that, to the point where when I was doing labor and delivery, I realized I was that first connection that soul had, because the nurses are the first to touch the baby, that it was a negative imprint. I was negatively imprinting on those babies my dissatisfaction with life. So I had to go through some energy healing and some emotional healing, and God had to fire me and tell me I had to get out of nursing for a while until I could come to understand where I'm at today. But it was a long, depressing time. But now I get it. And that's the coolest thing. So that's my story. Your turn.
Okay, like Deb said, I've been a nurse for a little over 40 years, and as I will share, I knew nothing about NDEs when I had my first experience. That was in 1997. I had moved into a small loft apartment, and I had a cat, and I fell asleep and in my bed, and I woke up with what I thought was my cat sitting on my head because it was pushing my face into the pillow. So I reached up with this hand to brush the cat away, and what I felt was the gloved hand of a man pushing my face into a pillow. And I reached up like this, and I could see the silhouette of him poised over me with his arm raised. And then the next thing I felt was intense pain. I remember thinking, ow, that hurt. And I thought about this I couldn't explain it for many, many years, but I felt as though I was being raised up into the air, and I thought, well, maybe this crazy guy that broke in my apartment was trying to lift me up, and I thought, well, no, it felt more like just floating. And then I was standing, and I was looking down at the bed, and I had that similar sense of detachment. I could see someone in the bed, but, and I thought, well, okay, that's probably me, and who cares? And the room was full of I think you can tell there's these really bright lights in the room, and they're very harsh on your eyes. Well, the light that filled the room was just as bright as this, but it was not harsh at all. This was 4:30 in the morning, and it was on November 7th, 1997. So there was no sunlight, and I had one small window in my loft apartment. It was 500 square feet. So it wasn't anything from the sun, but it was filled with this light. And I remember thinking, okay, there that is. And then the next experience, I was enveloped in the most beautiful blackness. It was total darkness, but yet it was alive, and it was caring and nurturing, and I felt wonderful there. And then I saw up to the right this round oval circle filled with what could only be described as the most brilliant diamonds on a black velvet. And I was thinking, wow, that's beautiful. And I started to move towards it. And then I was back, and I was no longer in the blackness, and the beautiful sparkling lights were gone, but I was in that gray and white realm, and I was listening to beings that felt familiar, and I felt safe, and they were telling me things, and I said, well, what do I do now? And they said, scream. And I remember thinking, okay. And then I felt a thud, and as I felt the thud, I could then became aware of my body again. And I wasn't not aware of it before, but the real realization came true when I came back with the thud, because I felt different. I no longer felt light or airy. And I remember thinking, I hope this isn't a dream where you can't scream. You've had those dreams when you're trying to scream. No, I started screaming. I screamed so loud that I strained my vocal cords, and I remember thinking, I'm screaming very well. Good. So then I heard these footsteps, and this guy running by, it was the man running by the bed, and he ran down, the stairs came down from the loft straight to the door. And I remember jumping up on the side of the bed and saying a few descriptive details, you SOB, what the WTF are you doing? And I flipped on the light so I could see him, and he looked back over his shoulder, and then he ran out the door, and I chased him right down that door. But when I got to this door, that was the first time I felt fear. And I thought, what if he's on the other side of this door? And I paused, and then I thought, I'm going to kill him. I jerked open the door, and he, of course, was gone. And then I felt this warmth coming down my face, and I saw blood dripping onto the ground. And what ended up happening is that I must have put my hand up here to cushion the blow, because this finger was broken. It's got so swollen it looked like a large dill pickle. And then I had an abrasive, avulsive type laceration here and a big hematoma. And then I had a big, huge hematoma here. And what we found out later, I don't know if you can tell, but this clavicle, this collarbone, is pushed out. So it was an anterior, what we call an anterior dislocation. Had it been a posterior dislocation, and perhaps it was, but had it been posterior and stayed posterior, I would not be here. So I had this, I don't know how long I was unconscious or whatever, but I tried to share it with the people I worked with. And these were skilled, knowledgeable physicians and nurses. And when I would try to explain what I had experienced, because I was really confused, they would, it's okay, you've had a head injury, you'll be all right. Oh, okay. So I then started having problems with watches. Jan said, if you heard her, NDEs have no watches. Well, I had a large collection of watches, none of which would work. And then I even tried, and I couldn't figure out what was going on. It was very frustrating, because this was in '97, and in the ER, you need a clock. And if you don't have a clock, you better have a watch. So I couldn't wear a watch because they broke, so I tried different watch bands. It didn't work. So then I tried pendant watches, and they didn't work. So I'd take them off, I'd put them on the dresser, I'd come back a few days later, the watch is working. Oh, okay, so I've just done it wrong. No, it didn't. So I gave up, not knowing anything, but I just decided I'd spend as much money on watches as I could afford. So that was in 1997. No one wanted to hear about it. They all looked at me anywhere from it's okay, dear, you've had a head injury, to you are weirding me out, and you've obviously sustained a traumatic brain injury, and you need some real help. So what did I do? I shut down. I didn't talk about it. I knew I was different, but I didn't talk about it. One of the things that was different was I worked with a physician who was, like Dr. Grayson said, he was not a skeptic. He just flat didn't believe in anything. Well, this is in the 90s, 95 or so, and I'm getting into herbs and aromatherapy and massage, and he's like, oh. And I had intuitive senses, and I was sitting there, and before we would kind of get into a struggle, and I was sitting there one night, and I knew the phone was going to ring, and I knew it was going to be for him. And I started to say, Dr. So-and-so, you need to pick up that phone because it's going to ring and it's going to be for you, which I knew would weird him out. It would just flat weird him out. And I started to do it, and this feeling of, and why would you do that to him? Why would you make him uncomfortable? And I could feel how he felt, and how that experience would leave him. It wouldn't be funny to him. It would not be kind. It would not be loving. And so I didn't say anything. The phone rang. I answered it. Hello, is Dr. So-and-so? Yes, just a moment. Here it is. So that was one of the first couple of changes, is that, one, the watches didn't work. And this, I always felt empathy for people. I think most nurses have empathy, and physicians also have empathy, but they kind of let the nurses be more obviously empathetic. So that kind of gives you an idea. People that would come in who they were the drunk driver and they had caused the wreck. And ER personnel are not perfect. and you've just gone from one bed where you're taking care of the person that's been critically hurt, and then you go down to the next bed, who is the drunk driver, who is an obnoxious, unfeeling, unkind, uncaring individual, and yet you're supposed to give them the same quality of care. And for the vast majority of the time, that's exactly what you do, all the time that you're going, "Rrr." But there's one of these changes that happened was that I could feel, I was aware, I was sensitive to how that person perceived the world and all of the hurt within him or her. And I would think, gosh, I'm glad I don't have to live in their lives. I don't have to live in their bodies. Well, that was great, except for if you talk about it to your peers, that's the drunk, and you need to give him a shot, or you need to take 6 times to get that IV just because you can. In other words, we could be very punitive. That's not something we're proud of, but that is a fact. So roll forward. That made me even more weird. Okay, so I'm shutting myself down more and more and more, and distancing myself, trying to shut out who I have become, and basically living a lie. So roll forward to about 2001. I've moved out of my loft apartment. I'm in another apartment, and I wake up one morning with the most awful sudden onset of a toothache, just bad. So I went to a local dentist, and they said, well, you need a root canal. We can't do you right now, so come back at 1:30 and we'll do you. We'll take care of it. So, I didn't go to the dentist because I had extreme fear, bad history with dentists and dental pain. So I knew that he would give me nitrous, and I was going to be happy. I had nitrous before. So I knew I was going to get it. And so I went out and I ate lunch. I ate a nice big lunch. How many people in here know don't eat big lunches before you get some kind of nitrous or medic? Duh. Too bad I'm not a nurse, right? So I come back, and I'm sitting in the chair. I am a child of the 60s. And that's when astral travel and out-of-body experiences were really the big thing. Well, there I was, at the ripe old age of about 18, and one of my peers was experimenting with astral travel, and then we found out that he traveled himself right into an orange and couldn't get out. And now he was in a psych hospital. And I'm thinking, I do not want to do that, because I would get trapped, and there I'd be in an apple, and somebody would come along, and that would be the end. So I'm in this body. I am going to stay in this body. I do not want to leave it. So I tell you that so that you'll have a mindset. So I'm in the chair. They put this bib thing on, and they've got a nice dentist. He's got a blanket on me. And as he's putting that little nose thing on you for the nitrous, this voice, a voice that I'm familiar with, it's not my own voice, says very clearly, you are going to leave your body. Now, as with Melinda, the difference is that did not cause me any anxiety. I was not afraid. I felt very peaceful. And the dentist said, okay, just take a breath, and I did. And then the next thing, I was standing on like the edge of someplace, and on one side was that same familiar bright but gentle light and gray, and these same beings, and we were having a talk, and they were telling me things, and I was telling them things, and the very last thing I said was, then my children will be okay. And they said yes. And then I moved from that beautiful gray and white area into the most wonderful light. And the light is wonderful, but it's what I experienced was total unconditional love, but also the joy of a homecoming. And I remember saying, I'm home. I'm home. And I have never felt at home in this world. It's just the way had come to realize. I've just never felt. Garth Brooks wrote a song that said, God ain't ever made a place I felt like I belong. Well, that's exactly how I felt, but not in that light. And interestingly enough, there was a bright orange center, and I was moving towards that, and I was being welcomed, and it was wonderful. And then this person who I knew at the time and who was alive, and who's, as far as I know, is still alive, was calling to me, calling mentally. And I turned around, and I remember looking, and they were way down there. And this person was calling me, say, come back, come back. And I was saying, no, not me. And then out from behind this person, I was being drawn closer to this person number one. Out from behind this person came this another person who was bathed in this nice, gentle white light. And she said, but what about me? And then that's when I felt a tug that said, I have some business, some more business that I could choose to attend to or not. And then, third person, that person that came out from behind the first person, I had no idea who they were in this life. Then the third person came whoosh right up in my face. It was so fast, I was like, and she was someone I met and knew, and she said, you must complete this lifetime. And I remember saying, no, I don't. You don't understand. I am here, you're there. I don't have to do anything. Well, evidently we had a conversation, and evidently she won, because here I am. But I remember the next thing is I'm in the chair, in the dentist chair, and the blanket is over me, and I can't move. But I realized that this wonderful lunch that I had is about to come back, and there's nobody in the room, and I can't speak. And then I hear a noise, and the dental hygienist had stuck her head in there just as I began to throw up large amounts of this wonderful lunch that I had, which I have never had since. No, once was enough. Twice, I guess. I had it twice. Had she not walked into that room at that very time, I would have most likely aspirated everything that I had eaten. And they just thought I was just recovering from too much nitrous. By the way, I've had nitrous since, and it's nada, nothing. I don't get to leave again. So disappointed. So anyway, the airway was cleared. And oh, by the way, while I was on the other side, it didn't fix my tooth. I still had to go back to the dentist and have a root canal. Really? So I still had more of the same experiences, the precognition, the clairvoyance, the enhanced empathy. And at that point in time, I had gone to work for a psychic hotline, which was, you know, when we have time, that's a fascinating job. And most of those people either needed a therapist or a lawyer or both. And that was okay. At 2:30 in the morning, I was willing to be a therapist. I have 5 lawyers in my family, so I could make a referral. But there were several times when I actually did have that mediumship experience. But once again, I had no idea what happened to me. But I knew that I was no longer the same nurse, but I could not be the fully, I couldn't give to my patients what I fully had, because my coworkers still didn't understand. They didn't know. They didn't want to know. And I was still shut down. And so I was still partially living a lie. Roll forward, and there was a cognitive dissonance, and I didn't feel right. So then I moved forward. I went on. I got a master's in counseling, and then I applied to the doctoral program. And this was in 2009, and it's the summer of 2010 or the spring, I'm not sure which. I was in Dr. Holden's office, and she said, "Well, I'm just wondering, did any of your patients in the ER ever tell you about odd or unusual experiences that they had?" I said, "Well, no, they haven't, but I can tell you what happened to me," which was, number one, that was something that I couldn't believe was coming out of my mouth, because I had learned, you don't talk about this. You don't talk about it to anybody if you don't want to get committed. And so I spontaneously was telling Jan, and I'm thinking, oh boy, here I am, a brand new doc student. I am going to get thrown out of the program. They're going to have me evaluated. But no, and as you know, Jan knew all about it. She said, you've had near-death experiences. And that began my journey here. And that's when I began to really process what it meant to be an NDEer. And I have spent probably since in the last 4.5 to 5 years processing all those emotions that many NDEers have. One, who am I? What am I? Why am I here? And I am so angry that I am not there because I didn't get a real clear-cut plan. Some people come back with, okay, you're supposed to go and do this and this and this, and this person is going to, they get a really well planned out description of what they're supposed to do. I did not get that, at least not in a conscious manner. And so I was just very frustrated, very angry. And I remember telling Jan, I realized walking across the campus one day that I lived only in this part of my body. I know this sounds crazy, but remember where you are and the people that you're with. And thank goodness I had Dr. Holden because, they would have carted me away because I felt like I was only in this much of my body. And I felt like I needed to get back in my body, and I had to focus on getting into my body. But I was continuing to work as a nurse, and I began sharing my experiences then because I had a name for it. I had an explanation. And I was amazed to find out that there were both physicians and nurses who said, I had a patient one time that did that. And one nurse told me, I had an adolescent in the ER who started to tell me about their experience, and their mom said, don't talk about that. And, just be quiet. And you could tell, she told me, you could tell that the adolescent felt shut down. So it is, and I have to tell you, the little face that came behind and that said, what about me, that I didn't know? Well, I met her a few years ago, and she's my partner. So I keep holding that over her head. I came back for you, so don't be asking me to do the dishes, all right? So how it's changed my practice is that I am able to be with people in intensely painful times and not get burned out. Unfortunately, we all have to learn how to cope with that much intense feeling. And what happens frequently is that nurses, doctors get burned out. And in the ER, we say you're crisp. And I was pretty crisp. But now I had realized I can be with these folks and not get burned out. But the other thing that I have grown as I'm continuing to grow in my understanding of what I am and who I am is that I can be with these people. I can hold people's like fire in my hand and not get burned. But I do need to withdraw at times. I need to have times of solitude because I am still in this body and in this life. And that I need to take care of myself. And that's not something that nurses or doctors either are good at, and that's what I'm learning to do. I need to take care of myself, that it's okay to withdraw. I don't have to be everything to everyone. And so I think, do you have any questions?
How much time do we have?
We have 15 minutes. Do you want everyone to go to if you'll go to the microphone so they can get the recording?
First off, is my thingy working?
I have no idea.
No. Oh, I just wanted to let everybody know, too, that we haven't shared our experiences. That was one thing that we wanted to make clear when we first talked, was we're going to show up and just be. We didn't even write like a agenda, because we wanted to allow you guys to understand our experiences firsthand. So I didn't even know.
We have never heard each other's story or the events or anything. So I'm hearing this for the first time, as are you.
It's awesome.
Yeah.
Okay.
A couple of things. First one, by coincidence, at lunch, my wife and I were talking, and she was telling me about one of the effects of meditation is that they've found with people like nurses, doctors, whoever working with a lot of trauma and all, who can get crisped very easily, kind of emotional burnout. She called it compassion burnout. Mm-hmm. She said meditation has been found to help with that, so that they don't get compassionately burned out. The question that I have is for you who spoke first, I'm sorry I don't know your name.
That's Melinda.
Melinda, you ended your talk with saying, I get it. Would you say more about that, please?
Sure. So I raised myself LDS, and in the LDS religion, I mean, I go back because that way you understand where I'm coming from. I was very strict on myself, right? I followed the doctrine of the religion to a T. There was a point in my life that I washed my own mouth out with soap when I swore because I didn't want to go to hell. So I was extreme. I took it to the extreme because I valued that relationship with God more than anything. And so meditation wasn't an option because in my mind, meditation opened up that spiritual realm of connection that now I meditate every chance I get, every day, because I like that feeling. But I was afraid of that connection. It's the weirdest thing when you're in a dogma of in a religion so much that I was very judgmental. I was very mean. But then I valued myself as being very spiritual at growing up, right? So now when I meditate, it's a different experience. But what I'm saying is when that journey from the experience in all my life of questioning where I'm going, what am I doing, how am I doing this, and just having an open relationship now, saying, whatever you give me, I accept, and we're going to go forward with this. Just like I was telling Judith, I didn't even book my airline plane ticket to get here till yesterday. Because yesterday I was like, how am I going to afford to get here? What am I going to say? Who am I going to help? And, and I let that physical worry of getting here, and I knew I needed to be here. So it was just I meditated, and then I walked out and did it. So yeah, meditation does help, but I get it. After being here, I get it. I get what my purpose is, more so than I did even just yesterday. And a lot of it is just allowing my experience. You guys, I've only told my story to 5 people before today. And that is my mom, my husband, my kids, and maybe one patient. I think I've told one patient that because their mom was dying. And I told them, oh, it's a really cool thing, actually. So, you're hearing something that's very raw to me of where I'm going in my life. And so I guess that's what I get. I get that it's actually a miracle. It's really cool.
So I would like to follow up with, actually a question for each of you. One for you with the meditation. Do you feel that when you meditate, are you touching that same energy, that same space as you had in your experience?
I don't know, because I'm learning to meditate. I'm really at its infancy. I've probably only been doing it for about a year or so. Right now, every once in a while, I'll hit that, and I'll be like, oh, ooh, and then when I recognize it, I'm out. It's like when you finally recognize, like when some people at the last meeting with Jen was saying that they saw through a medium, they saw it and then they were out again because they recognized it. It's kind of that touch and go thing. But I notice the frequencies in my body now when I meditate. I can feel the different frequencies. And so now when I'm awake, like today earlier, I was doing some weird funky thing with my hand, and I was like, okay, that's a frequency, knock it off, and had to like calm it down. So I'm still making those connections. Does that make sense?
It does, yes, absolutely. And for you, so after your first experience and you were told, oh, you've had a head injury, or oh, you know, poor thing, and you said, oh, okay. So, and having, you know, you're a healthcare professional, a medical professional, was there a part of you then that tried to convince yourself or believed that this was just something that I hallucinated or my brain made up, or were you always convinced of the reality of that first experience?
Without a doubt, I always knew that the experience was real. It was more real than me sitting here now. But I couldn't acknowledge it. I couldn't embody it, because it was, you know, when you never felt like you belonged, belonging is something you really want to have. And so I didn't want to be more weird than most people already thought of me. So I was lying to myself because I knew what was true, and I was lying to myself and saying, no, I'm not 5 foot tall. I'm actually 6 foot tall, and I'm going to go play for the women's NBA. That's the kind of story I was trying to tell myself. And just if I could speak back to the gentleman who talked about meditation, I too am beginning to embrace that. And it's come to me recently that doctors and nurses and healthcare professionals, we're all about doing. We are going to give you a pain shot, or we're going to take your appendix out, or we're going to do something. And so I've never really known what I'm supposed to do. And somebody recently said to me, well, maybe you're not supposed to do anything. Maybe you're supposed to be with these people. Oh, yeah, okay. No, don't tell me that. How do you just be?
We're supposed to answer. It's an answer thing, right? We're supposed to have an answer for everything.
An answer or a pain shot or a bandage. We're supposed to make you well. Right? No. So being with, I think, is the next step, which begins with learning meditation. And so that's kind of interesting that you brought that up. Yes, sir.
I have experience with EMS for about 10 years plus. I have a question for you regarding your experience. Since you have the experience, do you feel like you have the energy to influence the patients, that you can do things better now after the experience than before?
Well, I think that, so before this, before my experience when I was in high school and stuff, I would be able to feel, like if somebody was speaking in front of me, if they had pain, or, I kind of had an insight on their emotion. But since then, I've been able to kind of like Judith see from a different perspective. And a lot of times when my husband and I are talking, we always banter back and forth about things, if it's a business idea or if it's an emotional thing or if it's something our kids did or something, we'll banter back and forth on, well, what from this perspective or what from that perspective. So I'm able to see situations or business ideas or businesses, which is odd, from a full 360-degree perspective. And so when I'm doing my marketing and things for my business now, it's odd people think it's way out of the box, but the reality is it's coming from a different perspective. Does that make sense? And I can't use kiosk machines. They kill me. I am constantly going, somebody just touch that button.
Yes and no. From my perspective, yes, I'm not perfect, so I mess up sometimes. Yeah, I have a bad day now and again. But when I'm fully present, when I can be with people I don't know, who are having an acute heart attack, and things are moving very fast, and they are scared, and I can bring a sense of calm to them and a sense of assurance that is very helpful. But the thing I have become a little bit worried sometimes with the electromagnetic thing, you know, I was with a patient and he went into a lethal arrhythmia and we had to put the paddles on and we had to defibrillate him. And as Melinda said, I'm hitting the buttons and it wouldn't shock. And that, I will not do that anymore. Some other nurse, some PA, the ER doctor, I tell him, you do that, because this gentleman did transition. I think he would have anyway, but the fact that I knew I was hitting those buttons and they didn't go off. There's another doc student who's going to present later, and I always blame her for my computer difficulties until I was sitting at my computer like a week ago, and I was not touching the desk, and I was looking at a Excel spreadsheet, and I was looking at the number thinking, that number needs to be bigger, and I'm telling you, if I'm lying, I'm dying. The number went from 22 to 23, right there. I almost got up and walked out of the room. I just, okay, I'm gone. That's weird. So I don't know, maybe the universe was trying to tell me, don't blame Sarah for all your problems.
Well, and I think too, that's kind of funny. I would be like, wow, freaky. When I noticed that I always get the patients, when I was working the floor, I always got the patients who had, I always got the difficult ones. It's difficult, maybe they had intracranial pressure, or they had a mental illness, or they had something that no other nurse could figure out, and he was being a grouch, or he was mean, or I always got those patients because they would tell me, you're the only one that we know of that can take care of those patients and fix that. So a lot of times, they're on watch. So as a nurse, you're in the room all night long with them because they're wandering or whatever, and you don't want them to get hurt. But I would be able to sit and communicate with them and calm them. And actually, by the end of my shift, they were normal people. Like one day, I was working and I heard this big crash through the window, and I was like, what the heck? And I ran around the corner, and this nurse was yelling at the patient who was in front of her, going, you have AIDS, don't do that. And he had taken out his IV and was doing this at the nurses. And what he had done is took a trash can, a plastic trash can, and threw it through a double pane window. That's how mad he was and how strong he was. And I just walked through. I knew it wasn't him. So I was able to just walk through, and I sat on his bed, and all the nurses were freaking out because I didn't have all my gear on and my goggles, and I didn't look like an alien. And I just sat down, and I said, just sit with me for a minute. And he handed me his IV, and he sat with me, and we talked. And then the guards came in and took him out, and we actually ended up life-flighting him because he had intracranial pressure that was so bad that he really had no idea who he was. But I have that ability just to calm people.
Hello, ladies. So my question for both of you, as I hear you talk about sort of like a coming out of the closet, I've had these experiences, stepping away from the shame of not fitting the empirical evidence of how our science works in our country. Have either of you begun to write down your story, to actually commit it to paper, to put in some type of form?
Well, I thought about it. And I thought, I should have a book there when I'm speaking. I could make some money. But no, not really, because I just don't know what to say. Right? I think about it, and I write a lot, and I've written a few little manuscripts and things for business that's what I do for fun. But no, I've never written anything down about this. And it's funny because now when I tell people, I don't care if you like the story or not. It's my story. And that's what happened. You know, before I would be like, oh, I just won't say anything. But now I have a different plan, I guess.
Yes, I have, actually. Once again, thanks to Dr. Holden and her pressure. Oh, I'm sorry, I meant guidance.
It was worth a grade.
Something like that. And it was published in the IANDS journal, 2013, I think. So yes, it is been written down and published. The other thing that, like yourself, in the ER, I got two kinds of people. Those that were just really either having a psychotic break or were intensely angry. Mm-hmm. Go work with that person. Or those who were dying or their loved one was dying.
Oh, I love that part.
And, you know, you're really good with that. Mm-hmm. And I had this story, and I know we're about out of time, but this was a story that a little 4-year-old girl came in full arrest. She had been battling leukemia, I believe, for how many years can you battle leukemia when you're 4? But she evidently had was a very beautiful spirit. And her cancer had come back in the last month or so. And she had told her mom, I don't want any more of that medicine. And the doctors kind of said, you know, probably best time to honor her wishes. And so her condition was deteriorating about a week before she came in, and her mom started to talk to her about heaven. And she said, oh, Mom, you don't have to tell me this. God's already told me all about it. And Mom was just like, okay. So here they come in the ER, child's in full arrest. You know, it's hard enough to have a loved one pass. To have your child pass in your home is something that maybe not everyone can do. So when she died, Mom picked up the phone, called 911. But as soon as they rolled through the doors, Mom said, stop. I don't want any more efforts. But when she was able to share that story with me, because I was able to be with them, I was able to confirm to her that, yes, children do have those spiritual connections, and they do have times that perhaps as adults we may have forgotten, but they are real, and that's probably exactly what did happen, that God had already talked to her about how things were going to be, and that her child was not frightened. And to be able to be with that mom and confirm that with her, I thought that was a beautiful experience. And in a way, if being weird is what I have to be in order to share that with a mom or anyone else, that's okay. I'll be weird. I'll be weird. Oh, and it looks like we're done.
We're out of time. We have one more.
And they're giving us the
I
cutoff.
just want to acknowledge you for being so open and being so brave to share with people, because really we attract the people who need us, and by you being so open has given everybody the gift of being more open, and it enables our own healing from within. So I want to say thank you very much.
Oh, thank you. Namaste.